And I'm joined now by Medical Officer of Health from the Eastern Ontario Health Unit, Dr. Paul Roumeliotis. Welcome, Doctor.
Good to be back.
All right, so first of all, I will get your thoughts on the United Counties of Prescott, Russell, Stormont, Dundas, and Glengarry, and of course the City of Cornwall that jointly declared a state of emergency this week.
Yes, and that came after a lot of discussions with all three of those municipal partners and with myself, looking at trying to assess the readiness of our municipalities to be able to help us with in the eventual need of any quick changes or any extension of some of our public health measures. And this was done really not to panic anybody. The reason we enacted it was because we know that we're going to get more cases. We know that we're going to have to do some more social distancing, like decreasing the number of people gathering together eventually, perhaps extending the closure of businesses and so on. So it was really in a preemptive way to say that we're together. And the thing is that one of the things that I like about the fact that all three enacted it at the same time simultaneously, and that was purposeful, is because the Eastern Ontario Health Unit covers all those areas, and viruses don't respect those boundaries anyway. So I think it was just to make sure that they were ready. They had the ability to act quickly, ability to redeploy staff as needed, access to special funding and so on. So it was just to make us more ready to work together, as we probably will be looking at more cases. Not probably, I'm sure we're going to have more cases in our area. And as it becomes more and more entrenched in our community, again, this is part of our collective effort to together try to decrease the number of cases that will hit our area. And as I've said before, our area has a higher percentage of those vulnerable populations, including the elderly and people with chronic medical conditions. So it was really to say that, we don't have infections rampant out there. We assume they're there, but we're just getting ready. And this is just another way of making the municipalities more agile or more nimble and ready for any changes or any quick decisions that have to be made. And the ability to do those quickly is actually given to them and made more easily by the declaration of the emergency.
And you alluded to in the press conference the other day that in terms of that famous curve, we're really on the bottom, just starting to trend up. So maybe you can elaborate a little bit on that and why right now is really the time to act.
Well, the thing is, the curve is going upwards, and we know that every day there's additional cases. So what you want to do is you want to limit the number of cases. In other words, you want to, the day after tomorrow, obviously you don't want any new cases, but the new cases that come, you want them to come at a lower rate. You don't want to do what happened in the United States. In the United States, they have the most cases in the world, because what happened was they allowed Mardi Gras, they allowed St. Patrick's Day celebrations, they allowed all these things. They didn't do the social isolation and social distancing or physical distancing measures that we enacted, and so they're skyrocketing in terms of the numbers, and that's what we don't want. So when we're at the curve where it's going up, you have two choices: either it's going to go straight up like a rocket, or it's going to flatten out. And now is our opportunity to work together to be able to make sure that people who come home from out of the country to self-isolate, because 50% of our cases are still imported in. It's an opportunity for us to stay at home, work at home as much as we can, don't gather. And that's why we are ready now with the municipalities to, as necessary, together to be able to flatten that curve. So in other words, when we say flatten that curve, we want to decrease the number of new cases as much as possible. And that really means that we're going to have less cases hitting the most vulnerable.
And that's what it's all about: staying safe, not gathering together, staying home as much as possible. Dr. Paul, on that note, thank you once again for joining me for this update, and we'll talk again soon as this crisis continues.
No problem. Stay home, stay safe.